Antemortem examination of meat animals and postmortem examination of carcass. Antemortem examination of meat animal and postmortem examination of carcass. What is antemortem examination? Ante before mortem, death or slaughtering. It is gross and clinical examination of live food animal before slaughtering. Compulsory for all food animal and poultry to be slaughtered. Diseased animals are treated as suspect and should be segregated from healthy animal. Objective of antemortem examination: to screen all animals designed to slaughter, to ensure that animals are properly rested and offered feed and water, to reduce contamination on slaughter food slaughter floor by separating dirty animal and condemning diseased animal, to ensure that injured animal or those with pain and suffering receive emergency slaughter. Objective of antemortem examination: to ensure that only healthy or non-pregnant animals are slaughtered, to identify sick animals and those treated with antibiotic, insecticides and pesticides etc., to ensure that cleaning and disinfections of trucks used to transport livestock, to protect public health against zoonotic disease. Objective of antemortem examination: to prevent slaughtering of young animal, to prevent disease transmission to healthy animal, to detect disease whose identification is difficult at PM examination, to help in implementation of disease control program by tracing back source of disease. Reporting of antemortem examination: disease and management history should be reported on an AM inspection card. Owner's name, number of animal in load on arrival time, species and sex of animal, time and date of antemortem examination, clinical sign and body temperature if relevant, reason why the animal was held, signature of veterinarian. Basic consideration of AM inspection: a qualified veterinarian should conduct AM exam, should be done in lairage or in resting pen, should be done within 24 hours before slaughter, should be done in daylight, animals should be observed at rest and motion, facility needed to remove condemned or rejected animal. Abnormalities observed on AM examination: abnormality in respiration, breathing pattern different from normal, abnormalities in behavior, walking in circle, pushing head against a wall, charging in charging at various objects, acting aggressively, showing a dull or anxious expression in eye, abnormal gait associated with pain in leg, chest or abdomen or nervous disease. Abnormalities observed on AM examination: abnormal posture, trucked abdomen, standing with an extended head and stretched feet, laying with head turned alongside, inability to rise. Abnormality in conformation: swelling, abscesses, and large joint, umbilical swelling, hernia or ampullopilitis, enlarged sensitive under mastitis, enlarged jaw, lumpy jaw, bloated abdomen, etc. Abnormalities observed on AM examination: abnormal discharge from nose, anus, or vulva, excessive saliva from mouth, protrusion after birth from vulva, intestine from rectum, uterus from vagina. Abnormal color: red area on light colored skin, inflammation, dark blue area on skin or other, gangrene. Abnormal odor of abscesses, medicinal odor, stinkweight odor or acetone odor of ketosis. How we categorize animal after AM examination: passed from slaughter, passed for a second antemortem, animal insufficiently rested or affected by a physiological or metabolic condition, passed for slaughter under special condition, condemned due to presence of Meat-borne hazard, occupational health hazard, emergency slaughter. What is post-mortem examination? Systematic examination of dressed carcasses and their organ including blood immediately after slaughter in presence of adequate light by a meat inspector with object of providing wholesome meat to consumer. Objective of PM examination to provide disease-free wholesome meat for human consumption, to detect and eliminate abnormality including contamination, to ensure that only meat fit for human consumption is passed for food, to check the efficiency of slaughter and carcass dressing, to protect meat handlers from zoonotic disease. Facilities required for PM examination. Place PM should be carried out in slaughterhouse. Person conducted by a qualified veterinarian and may be assisted by a lay inspector for recording. Light PM site should have well distributed light of 540 lux intensity. Facility required for PM examination. Facility required for PM examination. Water, continuous supply of hot and cold water should be ensured at inspection point. Instrument, sharp knife, scissors, cleavers, forceps, etc. along with sterilizing facilities. Stepping ink, non-toxic, non-corrosive ink is used. A solution containing 1 to 2% fusin in acetic acid can be used. General consideration for PM inspection must be done immediately after dressing, should be carried out in sufficient light. A defined sequence is to be followed of carcass and organs. Precaution must be taken in suspected cases for zoonotic disease. Identity of carcass and viscera should be maintained. Inspector should avoid unnecessary cut. General principle of PM examination: identify carcasses and offals of corresponding animal, viewing palpation, incision, and olfactory teeth, classify lesion into acute or chronic, deciding localized or generalized condition, coordinating all observation of AM and PM finding to make a final decision, submitting sample to lab for diagnosis. Post-mortem inspection procedure should be carried out in a systematic and hygienic manner. Procedure includes following steps: gross visual examination, palpation of tissue and organ, making incision wherever necessary, use of inspector's sense of smell and taste, laboratory test, head inspection, inspection of gums, lips and tongue for FMD, necrotic and other form of stomatitis. Tongue and jaw should be examined for lumpy jaw and wooden tongue condition. Mastication muscles, cattle, buffalo and pig should be inspected for tapeworm. Retropharyngeal, submaxillary and parotid lymph node must be inside for TB lesion. Lymph node in head region. Retropharyngeal, parotid, submaxillary. Examination of carcass. An external examination should be carried out for bruising, injury and appearance of carcass for any abnormalities. In case of pigs, skin surface should be examined for blotchy skin, cyanosis and hemorrhages, African swine fever. Abdominal and thoracic cavity should be inspected for inflammation, abscesses and TB. Serous membrane, pleural or peritoneum shall be inspected and shall not be removed without informing inspector. Diaphragm must be examined for presence of TB nodules. Incision in muscles near shoulder and public bone without mutilating carcass for detection of cyst, bovis, cellulose and sarcocysts. Localized or generalized edema, hydrothorax, ascites, brisket edema. State of nutrition: muscles of emaciated carcass have a greater ratio of water and protein than healthy one. Efficiency of bleeding: Intercostal veins are detectable in poorly bled animal. Swelling or deformalities, bone or musculature, any abnormal odor, abscesses, size, color, and consistency of lymph node. Inspector should be pala- palpate and, if necessary, incise lymph node. Fracture bone and muscles, hemorrhages in epic. Extensive bruisage of a carcass. Osteohemochromatosis showing brown pigmentation of rib. Hematoma in abdominal wall of an ewe. Examination of lymph node. Size, color, and consistency of nodes from a valuable guide in estimation of disease in animal. Lymph nodes are absent in poultry, but lymphoid organs are present. Examination of lymph node. Size varies from a pinhead to walnut, usually round or oval, large in ruminant, larger in younger animal than adult. Color whitish and grayish, blue and black in color. Mesenteric lymph node of cattle are black, nodes are white in pig, reddish in head and neck. Consistency vary in different part of body. Nodes are softer in abdominal than thorax. Examination of viscera. All viscera should be inspected as they are removed from carcass. Every organ and associated lymph nodes are to be examined. In case of any abnormality, organ are inside and care to be taken not to contaminated other part and organ. Examination of lung, visual examination and palpation for evidence of pleurisy, pneumonia, tuberculosis, fascioliasis, and hydatid cyst. Bronchial and mediastinal lymph node should be viewed, palpated if needed inside of for TB nodules, small white nodules with semi-solid cheese like grayish, white or yellowish mass. Bronchial left number 1 and right to mediastinal lymph node. Examination of heart. Surface shall be examined. Longitudinal incision shall be made from base to apex through wall of left ventricle and interventricular septum and inspected for cystic circus or hydatid cyst in myocardium. Hydatid cyst. Hydatid cyst. Cystic cirrhosis. Examination of liver. Visual examination for fatty change, abscesses and parasitic infections such as hydatid cyst, sebovis, fascioliosis. Hepatic lymph nodes should be incised. Jaundice of cattle caused by liver disease. Multiple abscesses in calf liver. Melanin deposit in sheep viscera. Secondary abscesses in spleen. Hematoma of bovine spleen. Examination of stomach and intestine. Inner and outer surface examined. Serous membrane examined for TB. Mesenteric lymph node incised for TB nodule. Surface of spleen examined for TB, hematoma and infarctus. Button ulcer in large intestine and intestinal necrosis observed in hog cholera. Mesenteric lymph node. Sarcocystis in buffalo. Examination of kidney. Lymph node of kidney and adrenal gland inspected before removal of kidney. Kidney shall be exposed and surface inspected. Petechial hemorrhages in kidney, turgid kidney is a typical finding in hog cholera. In sheep, soft pulpy kidney are characteristic of enterotoxemia. examination of stomach and intestine, inner and outer surface examined, serous membrane examined for TB, mesenteric lymph node incised for TB nodule, surface of spleen examined for TB, hematoma and infract, button ulcer in large intestine and intestinal necrosis observed in cholera. Examination of uterus, ovary and udder. Uterus and ovary are examined for presence of tumor. In suspect case of brucellosis, uterus should not be inside. Udder should be examined by for mastitis or abscesses. Supramammary lymph nodes should be inside for evidence of TB. Postmortem judgment: fit for human consumption, unfit for human consumption, or total condemnation. Rabies, FMD, anthrax, rinderpest, BQ, CBPP, salmonellosis, septicemia, etc. Partial condemnation: benign tumor, localized parasite infection, sinusitis, etc. Thank you.